Valley Professionals Community Health Center is a one-stop shop for healthcare.
We are in West Central Indiana, right along the Indiana-Illinois border.
We are located in small town USA, rural community.
We serve 26,000 patients in 4 counties. We're in 14 schools, and we have 8 clinics. Our county is very broad, and there is no transportation services whatsoever. Poverty is extremely high in our area. We also deal with a lot of substance abuse disorder in our community.
With PCMH at its core, Valley Professionals is all about doing everything that we can for the patient, their health and their wellness.
Patient-Centered Medical Home, PCMH, is a way to improve healthcare in America by transforming how primary care is organized and delivered. It's comprehensive care, patient-centered, coordinated care with accessible services, quality and safety.
PCMH is extremely transformative for everybody in our health system, especially our patients.
We provide everything from primary care to chiropractic, behavioral health, endocrinology, dental, and then in addition to that, we have community health workers that can assist people with resources if they need food, housing, help with utilities.
When we provide all these services, it really does lower the cost of care for everybody.
When we build healthy relationships with our patients, that alleviates the hospitalization rates. We're constantly assessing all of the needs of our patients. Patients aren't waiting, and they're getting connected with care as soon as possible.
I do have 2 more patients coming in. A mother and a child recently changed housing situations and that, and just want to do an assessment to see if they're adjusting okay. Every morning, we try to have huddles with our team to kind of identify what the needs of the patients are that are coming in for the day. We have a pre-visit planning report that we run on every single patient that's coming in. And so it tells us if they are due for upcoming screenings, vaccinations, if they've had a referral out. We're seeing patients who have a lot of chronic conditions. We see a lot of diabetes, hypertension, patients with COPD, things like that, that these are chronic conditions that really affect their livelihood.
Our primary care does a fantastic job of identifying patients that are in need of behavioral health services.
We're providing several different screenings to them.
If they demonstrate some depression on a PHQ-2, then they do fill out the PHQ-9, which is a little bit more detailed.
Based upon their answers, we're then offering warm handoffs and referrals to behavioral health.
I can go across the hall and have one of those behavioral health providers come in and meet that patient at that exact point. Then they have a conversation. Then when we get that patient scheduled for that follow-up, they're much more likely to actually make that appointment.
All of our facilities right now are fully staffed with therapists, and we've even added to our psychiatry department to improve access to more prompt care.
We're using those screeners even once they get into therapy to look at reduction of symptoms. We're looking at patient progression.
The stigma of mental health is improving in this community.
It's like all your doctors form together to get you the treatment that you need to help you be successful.
Sarah came in full addiction.
I had started using drugs, meth, weed, and drinking heavily. I had found out that I was pregnant. I had the baby, and the DCS worker came out and she was like, "We have to remove him from your care."
She was working her way through recovery. We got her with behavioral health. She was able to do our addiction program.
I was meeting with a therapist once a week. I ended up getting into the group sessions.
You can share how much sober time you have, a little bit about how things are going on currently, and if you have any challenges that you're currently facing in early recovery.
Coming out of addiction, you're not used to having people that are on your side and rooting for you. Everybody, the CNAs, the CMAs, the nurses, the psychiatrists, the therapists, make you feel welcome and at home.
Hi. Hello, how are you today? Are you seeing Tosin today?
Yes.
All right, and what is your name?
Sarah Ward.
Dental health is so important, not just our actual health, but also for people's behavioral health.
Once I started actively using drugs, my teeth went like that. The dentists at Valley are like, well, we can give you caps, we can give you crowns to help you keep some of your actual teeth. And that was amazing to hear.
Valley's mission really is just all about providing integrated care to our patients, and that's what PCMH is. It's just providing all the services that you can in one place to better help your patients. It's improving their quality of life and ensuring that our patients can thrive.
After going through all of this help through Valley Professionals and all the programs, I'm in school full-time, I work full-time, I am in the process of getting my peer recovery certifications. I still attend a lot of meetings and sponsor people now.
What are they?
I've been granted my son back, and that was like the biggest joy and excitement for me.
If we were not here, if we did not have the ability to provide these services, patients would likely not be getting that care because wait lists at other organizations are staggering.
Everybody who works for Valley Professionals are people who grew up in this community. We're making a difference. I'm extremely proud of my team.
PCMH is how we're bettering our communities. It's just a phenomenal way to practice medicine.